I'm 58 years old, diabetic, and have 3 wisdom teeth extracted. My 4th wisdom tooth hasn't erupted because a nerve runs through it, and the oral surgeon advised against removing it. What are my options?
So you got a total of 4 wisdom teeth, and of the four, three have come through. One is under the gum line, and more than likely the oral surgeon advised not removing it for considering 2 things. Mostly one, not really, not because you're a diabetic. Of course, I understand that you have diabetes. As long as you have a controlled diabetes, we can treat you for the most part like as good as any other normal patient. Considering your age, more than likely the oral surgeon advised not to remove it because our cutoff, like we say usually like is about a 35 years old. So anytime you are over kind of a 35-year-old, meaning like if you are going to have like any type of risk or complication associated with wisdom tooth, the chances are of your risk going higher is very likely when you're over and above the 35 years old. So that is one of the possible reasons. And also sometimes you could be younger, but the nerve is sitting very close to the tooth, and it is very possible the oral surgeon is considering all the factors, the tooth sitting close to the nerve, and you're older, all of those reasons. And as long as there is no real reason for you to be removing that, it doesn't mean that you always have to have all wisdom teeth removed. There are many reasons. We just say, hey, you don't have to worry about wisdom teeth. They are not causing any problem. Just leave them alone. So it's kind of like I always joke with my patient, don't wake up a sleeping dog, so you don't have to. So you don't have to ask for trouble.
Now, what if it hurts?
If it does hurt, like it is a different story, right? And so that's a great question. So if it does hurt, let's say it is still lying close to the nerve, and you got to have that removed. So you don't have a choice. And it's kind of like, what I normally say in this patient, and to those patients, I explain to them, hey, you are hurting, and I understand that you're like a high risk patient. Then we explain all the risk, and the chances are like even though you may be a high risk patient, it doesn't necessarily mean that you're going to have any type of complications. It's just that we got to inform you, or maybe we inform every single patient. We have to better inform you or go into the complications a little bit more in detail, so you make a totally informed risk of what your risk and benefits are.
What are some of the risks?
Some of the risk, and just like she mentioned, the nerve damage, right? That's exactly what she's mentioned about, talking about the oral surgeon mentioned. So what is nerve damage to? To answer your question is, when you have a nerve or the wisdom tooth sitting closer to the nerve, you are going to have some kind of a damage to the nerve, which you will be feeling as there is some kind of an altered sensation or numbness to the chin or the lip following the procedure.